Hello, Dr. Tejas. Good evening.
Hey, hi, good evening.
Can you hear me?
Yes, I can hear you. Can you hear me?
Yes, you're audible, visible, everything is set. So we'll
Finally.
just begin. Yeah, we'll begin in a minute because I see many people joining in.
hmm
Yeah, so we'll just start in a minute.
Just let me know with this speaker, is it good or no?
The earlier one was better.
Better? Okay.
Yeah. So I think we should begin now. It's 9. Yeah.
hmm Okay.
So thank you very much, Dr. Tejas, for taking out time. And I know people have been waiting for this live for a long time. So once again, a big thank you. And I'm sure listeners are going to be, very much motivated and all have their queries clarified regarding the eye care and, what the myths around them. So because we as normal people hear a lot of things about eyes that do this, do that, but we really don't know that, which one is actually effective or which one we should really do or focus on. And I personally am very excited to talk to you and understand this because my son also has spectacles and so is my husband. So I think, and I also, while I'm lucky as of now, I don't have, but then at least 6 to 8 to 10 hours because of my job, I'm continuously exposed to the screen, and then barring that, entertainment also. So so it's very important to understand that how we take care of our eyes and stuff like that. So requesting you to begin the session, as in if you want to say something to our audience before I actually start the Q&A round.
Uh, okay, I guess first of all, let me introduce myself. I am Dr. Tejas, and I basically am from Bombay, and I have my clinic named as Netra Shakti Eye Care, which is situated in Thane East area. So let's begin. So main thing. So Abhireka is basically worried that she's spending lots of time on the computers. Will she get classes, or what will happen to her eyes? Basically, we have as a human, we have learned how to evolve. So we have gone from different ages, and now it is a digital age. So main question is how to take care of your eyes, especially when you are sitting for a long time in front of the computers. So it's something we have something like a 20-20-20 rule. Okay. So 2020 is anyways famous because of the cricket. So we just add one more 20 on it. So what is that
Okay.
rule exactly? So every 20 minutes, like
Okay.
this is basically for people who have to sit on computer for long hours, and they tend to be on the computer throughout without taking any breaks. So main idea is to after every 20 minutes for 20 seconds you have
Okay.
to focus on something which is 20 feet away from you. So
Okay.
what exactly happens is that when you are on the computer, your eyes are focused at something which is near you. So after
Okay.
some time, your eyes gets stressed out, and when you are working, you will not understand that. But the end of the
Correct.
day, when you are free, you will feel that your eyes are very tired. So after every 20 minutes, it is always good to give some rest to the eyes.
Okay.
That is one thing. Uh, Second thing, it is that when you are on the computer, make sure that the your screen is lower level than your head. Okay,
Okay.
so your eyes will be a little bit less opened. So when you are seeing down, your eyelids are down, and the exposure is a little bit less. And make sure that there is no AC blower, blowing over your eyes. Otherwise, it causes lots of dryness.
Okay.
So this was when it comes to how to take care of eyes in this digital age. Now there is something also like known as some glasses are being sold very frequently, with the blue filter. So many people are saying
Anti-glare,
that
anti-glare, anti-glare they call. Yeah.
anti-glare, the Blu-ray glasses.
Hmm.
So what?
Mm.
what is that doing is basically they don't prevent any strain on the eyes or the redness sometimes you get. They don't prevent anything, that kind of thing. But what happens is, when you are basically seeing a mobile or you are on the laptop at night time,
Mm.
what happens is that the brain feels that it is still a day. So what
Okay.
happens? Your sleep cycle gets disturbed. So now that particular Blu-ray glasses helps in, your brain will not feel that this is a daytime, because that
Okay.
the screen, how do we look? It brain always feels okay, it is a daytime. So your sleep
Brightness.
cycle, yes.
Yeah.
So that Blu-ray glasses basically help you in, preventing that sleep cycle disturbance.
Okay.
It will not prevent, that your eyes are getting strained or your eyes are have watering. So that is all related to basically dryness that happens because we don't, blink frequently when we are in front of the laptops.
Got it.
So that is two main things. Uh, and I'm sure everybody has one particular problem in their homes, that my kids are using lots of mobile.
Correct.
So this is one thing where you are not able to do anything about it. You will have to live with it. But obviously you can do something to get them involved in something else. It's like this is something which they see us, because as a parent, if you are spending lots of time on a mobile, they will do the same thing, right? So you try to
Correct.
let them go out, play with the friends. If they don't have friends on that day, play with them. I'm sure you will not be able to spend full time with them. But when it comes to like how to select what digital or what screen is good for your child, is it
Correct.
mobile, is it an ipad, is it a laptop, or is it a tv? I would say, if you have to select from anything, if possible, give them a tv which has the which is smart tv, where he or she can see the youtube or play games. Basically what happens, the distance between the tv and your child remains uh, uh, under
Much,
the
much
control,
more than, yep.
much
Yeah.
more. So main problem which happens is the near thing. So anyways, when they are going to study, they are going to use their eyes for the near work. So
Correct.
more, what happens as the digital time increases, the what they are focusing mainly is what to do when you are, everything, like the distance becomes very less between what you do and what you are doing, right? So it is always better to give them something like a TV option. So at least the distance will be good. So they will not develop, usually they, when they keep on looking at the near thing, the number for the distance slowly and steadily increases. Yeah.
And I also feel that mobile has certain harmful radiation, that microwaves or those radio waves. I think in TV that also gets.
Yeah, that is also there, but there is no as such studies where it is going to cause a vision loss or something
Not really
to the
vision, but
eyes.
I'm saying overall health. No, not specifically
Oh,
to
oh
eyes. I'm
yeah,
just saying that those mobile radiation, those continuous signals which it keeps receiving, I think even that is not good for health. So I think in
correct.
any way, a better option is a TV. It looks like.
Yeah, yeah. Anytime TV is the
Mm.
better option. But obviously, not everybody
In
has that,
control. Mm.
yeah, control. At the same time, not everybody has that, space in house that you can give one more room to your kid so that he can have his extra TV. The
I
best is
understand. Mm-hmm.
to, take him into, try playing some board games or something, something which they are playing on the video, like mobile. Try to get that. Let's say your child is playing carom on the mobile. It's better to get the carom board at
I
house.
understand. I
Yeah.
understand.
So
Even I
obviously
struggle.
they,
I have Ludo as board games multiple, but then they'll only enjoy it playing on a tab somehow. I don't know, but yeah,
I know.
there's
So
a
so
difference. Yeah,
it's, yeah. So basically, I guess all kids have taken Modi ji very seriously. Like, it's digital India, so I'll be digital.
I
You
know.
just
I
have to,
understand.
yeah, you have to balance
Yeah,
between everything.
I
Eventually,
understand.
I think the next generation also will get evolved. To, yeah, eyes will get evolved to see the screens for longer time. I guess we have already evolved, and we as a parent, we are also like spending lots of time. Initially, I guess when the computers came for the first time, people were not very much used to sitting in front of the computer for a long time. But now you can
Right.
see every time we are gradually evolving, and this evolving will be continuous.
And that is everywhere, I think it's not only say IT, it's like banking. Anywhere you go, I think it's only laptops, computers, and even for children, their online classes, even if the schools have started offline now, but still, the kind of homework or maybe the other exams which they have to give are still online. So I think that exposure, what you're saying,
Yes,
eventually has to grow.
everything has become online. Like now, even if you at many restaurants you go, they will give you a QR code, scan the menu and order it. They don't even give. So
Yeah, too much digitization. I think
yes,
one only good thing of lockdown, which would have eventually happened after 10-15 years, it is happening now. So forget about you're talking
and
about the hotel. I know my vegetable vendor, he doesn't take cash now. So
yes,
my even
and
the
and and Corona gave it an extra push. It
that's
increased
what,
the digit time very badly.
that's what I'm saying, which would have happened say maybe 15 years down the line, that everywhere having Bharat Pay or say Paytm. Now it is like in every house, and perhaps
Right.
every profession they're using. So in a way good. But thank you so much, Dr. Tejas, and really whatever that this 2020 rule which you said, I think is very useful, and we all should do like every 20 minutes we for 20 seconds we see something which is 20 feet away. Basically, we change our focus and maybe blink and all that thing. So I'm sure that's going to help. And as you said, that TV is a better option. I'm sure some of our parents are like us, are now know better that which gadget to give at the time when we have to. So thank you.
Yeah.
So before we go ahead and discuss around myths, I just personally want to ask that. I mean, how to maintain a healthy eye vision? Like today, I don't have spectacles, but obviously, I feel strained because I have extensive exposure to laptops because of my job, and sometimes my headaches and all that. So how I can keep my eyes healthy, like generally?
So one thing is 20-20-20 rule that you start following. So the amount of headache you get will be reduced. And when it comes to eyes, if you feel that tired, if you something there is dryness of the eyes because of less of blinking, but it
Hmm.
by default you are into the work and you forget to blink. What
Hmm.
you can do, you can keep some lubricating eye drops, with you, like artificial tears. So you can, if you feel anytime, you can just put one drop in your eyes for some time. And obviously have a healthy eating, especially the green leafy vegetables, which contains a good source of vitamin A, carrot, which also is very important, for taking care of the tissue of the eye. So that is one particular thing that you should take care of. And obviously, as ideally, it's required for you to go for a eye checkup at least once a year. Once a year is
Okay.
definitely recommended, because let's say what as such, I'm not supposed to ask your age, but so you don't have specs right now, but maybe after the 40 years of age you will start getting the near vision glasses. So after 40, if you feel more tired reading something, then you should go for a checkup and you see whether you have you have got any near vision glasses or not. And and obviously there are many things which even when you are seeing good, sometimes it if you detect it previously, then it is much better. Let's say something like diabetes. Many times patients have diabetes, they don't know that they have diabetes. The first time it happens that they come for eye checkup, we see something strange happening in the retina, and we go for the checkup, blood checkup and everything, and sometimes they are diagnosed for the first time by looking at the eyes that okay, this person has a diabetes. It is quite common. Also something like glaucoma. So glaucoma, you will never initially come to know that you have a glaucoma unless the damage sets in. So if something like glaucoma is detected before it starts damaging, then it is much better, because glaucoma is the periphery of the field of the vision slowly gets diminished. It's basically the intraocular pressure of the eye increases in glaucoma, and it damages the optic nerve. So any nerve damage is an irreversible damage. So any nervous tissue will never regenerate. So whatever damage happens, it happens. What you have to do is just prevent further damage. So I would always, advise everyone to get a yearly checkup done by any ophthalmologist. It is not that you just go to the optometrist and get your number checked. that is fine. If let's say if you have to like your numbers are increasing very frequently, but at least once a year you should get eyes checkup by a doctor.
Absolutely. And as you said, not only numbers, it may have associated diseases also, which may get accidentally detected as well. And, you can prevent them when done on time. Absolutely correct, Dr. Tejas. It's really helpful. Now, I would just like to understand, as I said in the beginning of the session, there are many myths around, you eat this or you do this and this happens and that. So just wanted to understand from you that how much real they are, if they're genuinely myths or are general facts. So that kind of thing I would like to hear from you and understand. So one myth which you say, one thing which I have often, I tell my child also that wear your glasses 24 hours or something like that, but it doesn't happen. So just wanted to ask you that wearing glasses 24 by, 24 hours, the time except sleep, is it necessary? Will it increase his vision, or will it bring his the lost vision, or it is good that sometimes he studies without spectacles also, so that your eyes are used to even without spectacles. So wanted to understand that.
If first thing is the spectacles, whenever somebody gets maybe a child or a adult person, it is because they cannot see properly without the spectacles. Okay.
Okay.
Now, most of the time, patient feels that if there are two myths basically. One is that if my child wears glasses, his number will remain stable. That is a myth. The number can progress even if you are wearing glasses 24/7. Second thing, if my child wear glasses, his vision will deteriorate. That is also another myth. It will never deteriorate. The number has, if it has to progress, it will progress. If it has to remain stable, it will be stable. So it is not something that glasses are a kind of a treatment. Okay, it is treating your current condition, but it is not going to deteriorate your vision over a long time, or neither it is going to improve your vision over a long time. But yes, sometimes what happens is when there is difference of numbers between the two eyes. Let's say my one eye is seeing everything very clearly, but other eye is not seeing clearly. So what happens, because since we are not going to any particular doctor, that particular, especially in the childhood, that goes, nobody detects it because the child never complains because he is seeing good with one eye. So what happens is that what brain says that your one eye is good, other eye is not seeing good. So it starts, the impulse given to that eye becomes less. And what
Okay.
develops is what we called in medical term is a amblyopia. So where the patient loses the potential of seeing in a poor eye if it would have been detected earlier.
I understand. Doctor, we have one question from Tushar. He's saying that should eye checkup be done by nearby vision stores is accurate, or as done by doctors? Because we do see many of these shops. I won't name the brand right now, but they also offer free checkups and all that. So are they can we rely on them, or we should go to the proper doctor?
Uh, uh, as such, it is always ideal to go to a doctor for a checkup because many times some things are there which is not picked up by them. I would
Correct.
not say that they are not good at number checkup, but yes, sometimes there are some situations where you need to put the drops in the eyes and see, especially in children. If in children we always put drops in the eyes because they have a very huge accommodative power. So let's say a person while going for the checkup is using accommodative power at its best, they will say that patient is having a -3 number or so. Okay, so that sometimes it ends up the patient starts wearing -3, and then after some time, so now to see from -3 glass, the patient or child has to keep constantly accommodating, and then that causes a problem. Uh, but yeah, obviously you also have many stores who have qualified optometrists, but obviously they will be able to give you a good number, a proper number, but sometimes some things can be missed at that level. They do dilatation at some places, but they are not that qualified to see your retina and tell you if there is something wrong.
I
You have got
understand.
like
Yeah, as you said, any associated disease which as a doctor can see an overall picture, they might miss it for sure
might
because of
miss it.
lack of their knowledge and experience. Well said,
Yeah.
doctor. The second myth which we briefly discussed previously as well, wherein they usually say that TV screens, computer monitors, they hurt your eyes, and if you sit close, it'll hurt more. But if you see with a distance, they are harmless. So, how much reality truth is in this?
So here, it is very important to observe your child's behavior. If the child goes very much close to the TV to see something, that means he is not able to see it from far. It is not that he wants to see it from near, but if he goes to it, to make sure that you get the numbers checked, because nobody is going to go very close to the TV and see. Okay,
Unless there's a issue in the
unless
vision.
there
So I
is a
think,
unless there is
yeah,
issue.
right. Correct. And I think these kind of symptoms or these kind of situations, for helps parents like us to understand that there is some issue with the vision. Maybe the same would be in the school when the child is not able to see the blackboard, and so and so forth.
Yeah.
The another myth which we often kind of justification which I have seen parents giving, that oh, my child got a specs in class 2 or class 3 because they don't eat healthy or they don't eat green leaf vegetables. So want to understand what I know, as you discussed, that obviously eating carrots and green vegetables do is good for your health. But what do you think is the primary reason for especially children getting vision loss or getting spectacles so soon in their life?
Uh, See, when it comes to getting spectacles at the early age, one is definitely the more of near work associated. Initially, it was only the school thing that was there, but now after school, the play also is takes place on the entertainment, and the play also takes place on the mobile. So it is basically that one particular thing. Second thing is the genetic factor also plays a role. Like if your father and mother both have glasses, and they also had glasses in their childhood, sometimes they also the child get. And sometimes there are some genetic variations where a child might get glasses even while the mother and father is not having. Second thing is also the anatomy of the eye. So when the sometimes you will find that there is all of a sudden height of the child increases, and they usually get numbers at that time. That is because the eyeball size also increases. Now, when the eyeball size increases, sometimes what happens, it does not increase in a proper proportion. It's sometimes only the distance between the interior part, the one which you see over here, and one which is behind. Okay, so basically the distance from the front part to the behind part, it increases, but overall it does not increase. So the focusing which you should be happening on the retina, it does not happen on the retina. Either it goes behind the retina or it falls in front of the retina. So that is the main reason why the kids get glasses. So it is nowhere related to food as such. Uh, so obviously all parents will hate me because when I say that it is not the food which is causing the, like, but obviously the food is also important. It is mainly for the tissue of the eye. Okay, like and the tear film that we have. That is the thing which usually uh, that is taken care of. And the second thing is the night vision. So night vision, if you have a vitamin A deficiency, sometimes you also end up, if it is very severe deficiency, you end up having a night blindness. So it is good
Okay.
for night vision. But as such, the vitamin A is not related with numbers. It is not that your child is not eating food, that's why he has got numbers. Sometimes they also complain that my child is eating very healthy food, then also he is getting numbers. So
I understand. While eating healthy is good for overall health, but one cannot guarantee that they won't have a perhaps a
yeah.
eye vision loss or something. Absolutely well said, sir. Another myth which we often see that here is that staring at sun can cause strain in your eyes, and we should not be directly looking at the sun. There are some rays and all that. So what is the fact around that?
Uh, I guess nobody stares sun except Amitabh Bachchan of Mohabbatein movie. The only curiosity that people get, they want to see the eclipse, especially the solar
Yeah,
eclipse.
very good,
So, so it is not at all advisable to see it with the naked eyes. So whenever I guess there is solar eclipse, you will be seeing lots of advisories from the government also that please don't try to see it with the
Don't,
naked eyes
yeah.
because what happens, you must have seen, right, that when you have a lens in your hand and your sun's power is projected at one particular point, it starts burning, right?
Yeah. So that
Correct.
is the energy.
That
Yeah.
so that is the energy the sun has. So when there is a solar eclipse, sometimes you get burn in your retina if you try to see it, with the naked eye. So
Okay.
never try to do that. If you want to see something, go to places where they show you the eclipse. Something like a Nehru Planetarium. I guess these people have some sessions where you can see it. Best is to see on TV. Nothing will happen.
Yeah, and I think they suggest some glasses to see it and not to see it with the naked eyes or something like that. But
Yeah,
as you
yeah.
said, the best is to watch online. Okay. The another myth is that we get vision loss is due to genetic and hereditary, which you briefly mentioned. So is this it's a fact? It's a fact that or it's a what do you say? It's a mandate that if your parents have spectacles, you will also have. Is there any correlation
No,
around
it
it?
it it is not a mandate, but yeah, the probability of getting spectacles increases if your family history has that particular spectacles history. Okay. And otherwise, obviously, there are some pathological conditions of the eye which are genetically predisposed. So that there are some things where if your mother or father has, you will definitely get it. Get it.
Correct. Another myth which we often hear is that cataract only happens in elderly. But quite recently, I was very surprised. One of my very close relatives, who's just like 38, 40, he also got cataract surgery done. So, really wanted to understand and what is the age for cataract? And we usually think that it used to happen because it happened with my grandmother also. So, I'm just saying that earlier, before that it happened, I also used to feel that it happens only in elderly, but these days it's happening to very young people also. So wanted to know on that.
The cataract has got different reasons. Okay, you will not believe, but even a newly born child can
Okay.
have a cataract,
Oh
which
my
are
God.
like
Okay.
congenital cataracts. Okay, commonly, obviously, it is seen in the older age, but it is not something that young people or child cannot have a cataract. Even a child can have a cataract. Right? So many times, what happens? The child has a cataract. One eye is normal, and other eye is cataract. So after say, if it gets undiagnosed, when you operate on the eye which has cataract, already the potential of the vision is gone because it was diagnosed very late.
I understand, and it had must have damaged the eye to the extent.
It does not
Uh,
damage the eye. The way I said initially, it behaves like that eye is not seeing properly. So the brain, the impulses from the brain does not go into that eye. It will go into the normal eye.
okay,
So it
okay.
will
So
again
the
act as
other,
an amblyopia.
yeah, the other eye will be strained more than that way.
I will not say it will get strained more, but brain will just think that I should give power to this eye, and the other eye
Okay.
is because the brain gets confused because you are seeing good from one eye and not from other eye. So eventually, brain has to fuse both the eyes the image. Now, when one eye is seeing something totally different, the brain will choose that which eye is seeing better. I will connect. I will take impulses from them itself, and I will neglect the other eye.
Which is an incorrect way, I understand. One of the last myths which we're going to discuss is that people say that if you do the get up early, do that exercise, do that eye yoga, and the your spectacles would go, or all those things. So how much truth is in that?
Uh, Everybody can try it once. Uh, I've never heard of anybody, coming and saying that my spectacles have gone. Uh, Obviously, I have not even come across somebody who has undergone eye yoga. But if somebody has gone and can tell me, I would be good to listen to
There are a
that
lot
person.
of eye exercises. They say do the ball and all this thing, and there's so many because I also keep reading this as I said, but I don't know how effective they are. But as you said, you are not aware of that. But Doctor, just now that we've discussed on myths, a couple of common questions. I do see squint also very common. It is there in my family. I've seen some of my friends, children also being affected. So what is squint, how it happens, and how can one remove it? Is there any age by which it should get rectified or something? If you can cover that.
There are different reasons for squint happening. Sometimes the squint is very evident. Sometimes
Yes.
squint happens only some particular time. But
Okay.
it is a very it is a very vast topic in ophthalmology. So if at all you have a squint, you should first find out what is the reason of the squint. If it can be operated, it should be operated as early as possible. So we have in ophthalmology we have a specialized field, which is basically taking care of the squint.
Okay.
So they are the best person to diagnose that what is the reason and whether an exercise. So on those cases, the exercise sometimes help. Okay, when the patient has squint, but that is not something doing on your own. It is on some machine which
Mhm.
is called as like a synoptophore. So depending on the type of the squint, the doctor will be able to advise you whether any surgery can be done or not.
I
So it is
understand.
like sometimes one eye is not seeing properly, it can go into squint, and
Okay.
sometimes because of the squint, one eye does not see properly. So it can be
Oh,
anything.
either ways. It could be an after
Yeah,
effect or a reason.
correct.
Absolutely,
And
sir.
many time people say that ये बच्चा बड़ा हो जाएगा तो अपने आप ठीक हो जाएगा. So that if a squint specialist tells you from his mouth, then you believe it. But if just people around you, if they tell you कि अरे अभी कुछ मत करो, so it is not good.
And I think earlier the better. As in, if you see some problem, if you operate it before time, is good. Yeah.
Yeah.
One last question from my end. Now that my son also has spectacles and he got at a young age, just asking. I mean, I heard about laser operation, all that, but is there? I mean, what are the other options where I can get his, maybe spectacles removed, or if he can get his vision back? I mean, will it happen?
See, the laser, first is let's consider the laser thing work has to be done only after he is 18. Okay.
Yes, that I know.
And that too, we have to be very sure that his numbers are stable for at least a year. If the
Okay.
number is progressing, if you do LASIK, it is always, anyways, going to progress. So you should have a
Okay.
record of his numbers. It should be stable
Okay.
for 1 year.
Oh, yeah.
Okay.
Mm-hmm.
Usually we say 2 years, but 1 year is fine. So, but there is nothing which can get the vision back. So either he has to wear spectacles, or he has to move to contact lens if he does not want to go for the surgery. And obviously, he also has to like it is not necessary that he or she may uh, you know be fit for the laser surgery. Not everyone is fit for laser surgery.
Okay.
Sometimes people have such numbers, the corneas are such that if you do surgery in that, they'll end up into some complications. So not everyone is fit. So whenever we do LASIK, we initially do the scans of the cornea. We check the thickness. Then only we, think whether the LASIK can be done or not.
Okay. So
As such, there is no magic that will take the glasses away from your child.
I understand. I can only motivate him to have a healthy eating habit. Okay. So, Dr. Tejas, it's really, really insightful, and it's so wonderful talking to you and understanding. And I'm sure all of us who are listening us live and maybe will see us later will be benefited. And it's really wonderful. So, before we conclude, is there any final message you would like to give to our listeners?
Uh, I would just tell you that God has given you two eyes. When God is giving you two eyes, which are in good condition, try to maintain them in good condition, and see your ophthalmologist at least once a year. And depending on different conditions, if you are having, depending on that, the frequency might increase as well.
Absolutely. Thank you very much, Dr. Tejas. And a couple of takeaways: that 2020 rule, once a year, at least, biannual or annual checkup, and, maintaining a healthy lifestyle. I'm sure, as you rightly said, God has given us two eyes, and we have to see the world beautiful and make the world beautiful and feel happy about it, isn't it? So
Yes.
thank you, Dr. Tejas, and to all the listeners. He's an excellent doctor. I have personally experienced. My son's favorite. Everybody just loves him the way he treats us and tells us. So I'll be posting all his links and how you can reach out to him for any queries or any of your checkups. So once again, have a great evening, Dr. Tejas, and thank you for your time. Good night. Take
Thank
care.
you. Thank you for calling me and having this session with me.
Absolutely. Thank you.
Okay.
Thank you,
Yep.
Dr. Tejas. Good night.
Bye. Good night.